Wellness Wednesday, Ask Dr. Gator. Okay, so this is a very common question I get from people who are taking GLP1s, and this is people's biggest concerns. Again, GLP1s, compounded semaglutide, tirzepatide, Ozempic, Zepbound, Wegovy. People are concerned about the side effects, and trust and believe the side effects are real. But again, if you understand how the medicines work, then you understand why you have certain side effects, and we're going to talk about a little bit about how to manage them. So first and foremost, nausea. Nausea is one of the biggest side effects of the medicine, and it has to do with how the medicine works. So the medicine does cause food to release a little bit more slowly from your stomach. That causes the food to sit on your stomach longer, stretches your stomach, helps you to feel full. But at the same time, it changes many people's digestion, right? So there's a few different ways to combat that. But one of the things is, if you're overeating, this medicine is almost like, a Pavlov effect. It is a negative impact to prevent you from overeating. And so when you overeat, you're overstretching the stomach because the food is sitting on your stomach longer, which is going to make you very nauseated, and some people throw up, a lot of side effects like that. So what you want to do is be very conscious. As you're starting to feel full, you want to stop eating before you just feel totally stuffed, right? Like Christmas, Thanksgiving, when you're just eating everything and then you're like, oh my God, I feel so nauseated, I feel so bad. Yeah, that is exactly it. That's the side effect. That's that nauseated feeling that people have, again, because it's causing the food to release more slowly from your stomach. That's one of the ways that it's working. It's working at the digestive level. One of the second most common side effects is going to be constipation. And again, because it's changing the digestion, and so some people have less digestive enzymes. So one of the things or tricks is going to be to actually take a supplement that has digestive enzymes to help you to digest your food, so that that's less of a side effect. So that'll help to decrease the gas and bloating. A probiotic will help to also decrease that. And in terms of the constipation, I typically recommend that patients take magnesium. At bedtime, it comes in a pill or a gummy, and you can start with anywhere to between 1 and 2 at bedtime. And then if you're still constipated, you can take up to 4. If you do that and you're drinking plenty of water, you're typically going to have a natural bowel movement in the morning. The next thing, again, you need to check with your doctor on all of these different advices. But the next thing that I tell people is smooth tea. But when you're talking about incorporating things in your lifestyle, then drinking the tea, people tend to like to do that a little bit better. So, if you drink the smooth tea, you need to make sure you're drinking plenty of water so it doesn't cramp you. And again, depending on whatever medicines or other things you're taking, you need to check with your doctor. But those are kind of things that I tell my patients to incorporate into their regimens, into their lifestyle when they're taking this class of medications. Hope that helps.